You are watching the Doctalk show.
Welcome back. Before we went for the break, we got to understand certain factors predispose someone to getting blood clots. For example, cancers, physical inactivity, and certain drugs such as the contraceptives. So I want to understand how one can identify or can tell that they might be developing blood clots. Are there certain signs and symptoms that arise as a result of blood clots? So Dr. Doom, our expert in this field, how can one tell that they have a blood clot in their leg?
I'm sure everyone is waiting for that.
Yes, because it's the most scary. If we've told them it causes lots of problems.
For those who are fortunate, they might have signs, symptoms. But there are those who might not have significant symptoms, and for the first time they present with a complication of a blood clot, like pulmonary embolism. But the commonest presentation is swelling of an affected leg or limb. It's commonly one limb that is affected. And actually, with experience, left is more affected than right.
The left is always affected.
Yes, it's more. We need to publish that.
Is there any reason why the left might be?
That's why I'm saying we need to do more research.
Okay.
But from personal experience, I see more clots on the left than the right. So a person is going to present with swelling of a limb. And when they get that swelling of a limb, it feels like someone has pumped, especially around the calf area. You feel like it's tight inside there. And for such people, they might get this following maybe a recent travel. Someone has traveled from abroad. They were on a flight of more than 8 hours. Or someone has been in hospital. Or someone is pregnant. Or someone has nothing. And it just happens like that. So it's the commonest presentation. Swelling of the leg, usually unilateral. Although you can also have bilateral swelling.
Like right, usually one-sided, but it can be both.
It can also be both. Okay. So that's the commonest. And this swelling is associated with pain and discomfort. There's some kind of discomfort that one feels to the extent that they start looking out for massage. They want to pump the leg, to hit it, because it feels uncomfortable. So many of them will actually first go to a massage parlor and have this worked on. And then sometimes you have distension of the vessels around the limb. They look like the veins. You know, someone who has been working out in the sun, how the vessels become prominent.
So they can see it in the legs, they become very big.
Yes, the superficial ones. And that's a result of traffic congestion within the deeper veins, so that you get a bit of blood coming out into the lower veins. I mean the superficial
the outer veins.
Yes. Some people present with a bit of warmth and pain. And for those who get really bad complications, you might find a leg that is almost looking like it's burnt.
It turns black.
It turns color. If they have an arterial clot, the leg is going to become very cold, extremely painful, and eventually turns color. From kind of whitish, then becomes a bit purple. And when you start seeing those symptoms, it means the leg is dying off. And it has to be worked on immediately.
Immediately.
So those are the features of a clot that forms in a limb. There are people, as I said earlier, who might not get all those.
But as you evaluate, quiet,
you find they have a problem.
Okay.
When one has a clot that has gone to the lungs, the most feared complication, sudden onset of shortness of breath. Someone cannot breathe properly. And some people, when they get, they try to breathe. Each time they inhale, they feel a lot of pain, especially to the sides. They feel a lot of pain. Some will have a bit of a cough, and they cough out blood. You cough, and phlegm has blood in it. And other times, someone will just present with sudden collapse, especially if it's a massive one. When they go to hospital, the blood pressure has dropped, the heart rate is like moving so fast, and you can't detect. They are diaphoretic in English.
They are sweating too much.
Too much. and someone is actually failing to express what's going on. Those are some of the symptoms of a massive clot in the lungs. The chest pain of a blood clot in the lungs, one takes a breath and they hold it. They don't want to breathe because it's too painful.
It's like the knives are cutting into the lungs.
Whoever has gone through that, they will tell you it is one of the most painful situations. However, when you have painful breathing from a clot, chances of surviving are higher than when you present without pain.
How is that? How is that so? When the pain is there,
when you present with pain, it means the clot has formed to the outermost vessels. You know, when you look at a vessel, it's like this arm. You have a big one, then branches off.
That's dividing into smaller ones.
So the smaller ones, if you get clots forming there, then you'll have no blood flow to that area, and you get pain. But if you block here, the big
vessels,
everything is just cut off. So there's no room for getting pain. And those are the people who get sudden death. Or you are traveling and someone collapses, you find them seated, dead, because of a massive clot.
Okay. So,
but before this, when I talk about a swollen leg, many of you have heard about something called a tallow. So many of our people who have died because they think they've been bewitched. The leg is swollen because of a tallow. It's a very common thing, but to me, my humble appeal would be this. If you think you have a tallow, do the opposite. Because traditionally they say if you have a tallow, you don't go to hospital.
They think it is a witchcraft event.
But if they ever inject you, you'll die. Okay? Now, I want us to change this thinking. When you have a tallow, as they call it, run to hospital. When you run to hospital, they will investigate. Let the doctors tell you, no, this is not a clot, this is a tallow. Because they will have ruled out the possibility of a blood clot that could kill you. I don't know if people get this. They even tell you, if you go to a hospital, the tallow will move to the lungs. And if it goes to the lungs, you will die. Which is a good analogy, actually.
They're actually describing the blood clot.
The blood moving from the leg.
They think it's not a blood clot, but it's some witchcraft event.
So our people need to understand this. Whenever we understand thrombosis or blood clotting, as us, the general people, we are going to reduce on the risk of dying as a result of a blood clot. We are going to reduce on the complications associated with a blood clot.
Okay. So, given you've now explained how one can identify the features. So when they get to hospital, what would happen to them? Will they undergo surgery?
When you go to hospital,
yes,
we need to confirm that you have a blood clot. So we look at the symptoms you've presented with. A symptom is what you complain of. Then the doctor is going to evaluate you, to examine, and actually find, yes, there's a swelling, the one leg is more swollen than the other. They look out for the peripheral pulses. If the pulses are absent and the leg is cold, they'll think this could be a clot in the arteries, so they have to intervene in a different way. So they will do a physical examination and then order for investigations. But before they order for these investigations, there's a way we risk stratify you.
There's a score system which the doctors will follow.
You are in a lower risk, you are in an intermediate or high risk. So using the system the doctors have, they can tell, okay, for you, we don't think it's a clot because you have an infection here, you have this and that. This can explain what you have. However, we shall still investigate if we feel we should. This stratification helps us to know who to take for those various investigations. We now do a test called, it's a simple blood test. It's called a D-dimer test. And it's a measure of the breakdown of products of clotting. Under normal circumstances, whenever you form a clot in the body, naturally the body will
has to
try to
break down.
eliminate it. And that breakdown process produces factors that we can measure in the lab. So normally we say 0 to 0.5. If you present with 4, that's too high.
It's too
It
high.
means we have to further evaluate you.
Means there's a possibility of a blood clot
It's
somewhere.
high. Although it doesn't confirm that you have a blood clot.
What would confirm the blood clot is there?
We'll do, for example, compression ultrasound scan of the leg to see if there's a clot there. If we do our tests and the specialist tell us, yeah, there's a clot, then we treat. We can send you for imaging if you think it's in the lungs. There's a special CT scan that we do to evaluate the lungs and can show us where the clot is.
Okay.
And of course, there's one that we can do that we call a venography, where we put a dye and it moves through the veins to map them out and see where we are.
Map in the lungs. So all these tests are available in the hospitals within Kampala, at least at the National Referral.
At the National
at the
Referral,
Cancer
we have
Institutes,
all of them.
and probably in some of the regional referral hospitals.
Most of them should have.
Okay, so people should be
Especially
confident.
ultrasound.
So people should be confident that the health system, yes, can help detect these blood clots, and the doctor is able to initiate appropriate treatment depending on what they find. So we're going for a short break, but after that we'll come to understand what is probably the most important discussion, how to prevent blood clots. Okay, because I already understood they're very problematic, they cause death in so many cases. How can we protect ourselves from getting blood clots that go away?
You are watching the Doctalk Show.